All right, for years, American intelligence leaders are now warning of a possible cyber Pearl Harbor attack from the Chinese. And as our infrastructure, cybersecurity is being bulked up, it's our healthcare system that is vulnerable to a cyber attack. Dr. Peter McCullough has been sounding this alarm, and he joins us now. Dr. McCullough, why is our healthcare system so vulnerable to cyber attacks to begin with?
You know, healthcare is mobile in terms of information now, and so many offices, clinics, and other healthcare environments now are using wireless technology, and the vulnerability appears to be routers. And the most recent government intervention on a Chinese perpetrated cyber attack was actually focused on the routers. There's an array of electronic medical records. They don't have uniform safety standards, and many believe that the healthcare infrastructure, in terms of information, is vulnerable.
Cyber attacks, though, Doctor, are just one area where non-conventional warfare could impact our healthcare system. We're increasingly hearing that China could use its dominance in our supply chain to cripple our healthcare system. How real is this threat?
It's very real. Over 90% of our generic drugs come from either China or India. Overall, by volume, about 25% of all of our drugs that we use in the hospital have their origins in China. The group purchasing organizations, work with Chinese companies for provision of these. These are all vulnerable. We know that varieties of sanctions, tariffs, other things coming from either side could threaten our drug supply. There hasn't been a good review by HHS or our Department of Commerce on security of the drug supply, and I think it ought to be looked at.
Yeah, well, they're too busy, I guess, making sure that we all wear our face diapers. All right, how, though, has China, this is the part that doesn't ever make sense to me. Why aren't there laws? Why aren't there provisions? Why aren't there stopgap measures to prevent China from gaining such a dominant position in our healthcare supply chain?
It's a market-driven process, and there's an intermediary between the hospitals and the suppliers, and that's the group purchasing organizations. There, it's an oligopoly. So the group purchasing organizations have tremendous power on both sides, on both the procurement and then the sale to hospitals. And again, I think they should be carefully looked at, because anytime there's a reduction in diversity of intermediaries, we're at risk, not only from the GPOs, but the suppliers that they interact with.
RFK Jr. has obviously made healthcare and the jab in particular a centerpiece in his campaign. It remains, though, to be seen how much traction he'll actually get in the fall. How much do you think the issues that RFK Jr. is raising will be critical in what will ultimately be the Trump versus some Democrat fight?
It's going to be a gaining proportion. Now, we know January 12th, 2024, the Rasmussen survey came out. There's been a series of these. That survey indicated 53% of Americans think the vaccine is causing serious side effects and resulting in large numbers of deaths. We know healthcare costs are rising. Insurance claims for all-cause mortality among working-age individuals who worked at employers who mandated the vaccine are now recording record numbers of deaths. We're approaching 4,000 peer-reviewed manuscripts on vaccine injuries, disabilities, and deaths. And so at some point in time, each candidate's going to have a strategy to deal with not only the escalating healthcare costs related to these vaccine side effects, but also the vaccines themselves. I've called for in the U.S. Senate and now also in the House of Representatives to pull the vaccines off the market. We're 4 years into the pandemic. It's essentially over with. We have early treatment approaches. The vaccine has never stopped COVID-19 in terms of its incidence, its transmission, or reduced hospitalization and death. The vaccines could be retired, and it is so interesting why there is an allegiance to the vaccine by certainly our Republican and Democratic candidates for president. So Kennedy will have to build the case and actually have to understand what percentage of the voter bloc that this is really a key issue.
Yeah, it's interesting. Somewhere it seems like between Obama letting basically socialized medicine take over our healthcare system and the end of COVID, it seems to me like the medical community has become more and more incompetent. Loss of faith in the medical establishment, concern about the influence of big pharma, fears about China's ability to cripple our system, and just misdiagnoses and things that we're seeing on such a much more increased basis, it seems. What can average Americans do who are concerned about our system overall?
Americans, I think, should diversify in terms of their health care provision. I advise the wellness company as the chief scientific officer. That's another layer of a second opinion, just-in-time telemedicine, access to healthcare in terms of diagnostics, laboratories, imaging, therapeutics, as well as nutraceuticals and supplements. So more and more cash-based systems are becoming available as low-cost additional sources of healthcare. You're right. Americans have lost trust in the healthcare system largely because of the corporatization of large doctor groups and now the pandemic response debacle, both the failure to treat patients early, preventing hospitalization and death, and then this relentless support for the vaccines, which were never safe or effective.
Yeah, well, Dr. Peter McCullough, thanks for being here. Thanks for what you all do at the Wellness Company every single day. Appreciate you.
Thank you.